how she had to have her colonoscopy delayed. And that was complicated, of course, by COVID. But, with these discussions in universal healthcare places, there's always this question of like, well, are we getting the best services that we can? We'll hear from Fox and similar outlets that, bureaucracy in universal healthcare environments, fails, that it isn't nimble, that it's not a buyer's market. And, it's true that there can be waiting lists for procedures here in Canada. You can't buy your way to the front of the line in the public system. There is private care that you can pay for if you've got the money. But why are there delays? Why are there waiting lists? It's because the organization of universal healthcare is an expression of political will. It's not just that, governments can't do healthcare. It's that governments can do healthcare when they are supported by the political will of their constituents. So waiting lists go up in part where zones of a universal healthcare system is underfunded. And usually that happens here in Canada. That's typical in center-right provinces who, are looking at the predatory inequality of U.S. capitalism and thinking that, oh, that's a great idea. Or they're pushed in that direction by their own funders, who are large employers who want to pay less or less taxes, or or doctors associations that want to be paid more. So universal healthcare systems can be cumbersome, overly bureaucratic, but that's just like any vast organizational effort. Their efficiency is really impacted by values politics more than anything else, because we all know that when we value something, or that when those in power value something, it gets paid for. The military, the Gulf War, the abortion bounty in Texas, that's going to get paid for because people value that, or enough people in Texas value it that they were able to sort of game it into law. So confusing that order of operations, ironically, it complicates the entire project of universal healthcare. So, when you complain about efficiency as though it were a feature of socialized organization instead of an ongoing expression of values, that's a mistake. And what's really, really awful is that when Canadians listen to Fox News, and when Canadians listen to Rush Limbaugh, or when they did, and when they get told that their universal healthcare is broken in some way, Fox is actually helping to break it, because the whole system depends upon political will. I mean, we saw the same thing happen when the Brexit dipshits in the UK started claiming that privatizing healthcare was going to create better services, which is a total lie. It just never works that way. So anyway, I just wanted to say we get the system we value, and what Americans on the right most love to do is to shit on the values that other people hold, especially if those values reveal their own moral poverty.
Yeah, and there's another fallacy at play there too, right? Which is that usually it's this criticism of it's this comparing of boutique healthcare for the super wealthy and everyone else can basically get fucked, versus really good healthcare that may be somewhat inconvenient and not on tap for you the moment you sign up for your knee replacement or something.
Totally.
It's this complete, the sense of proportion is completely screwed up. I should say as well that with that $10,000 bounty, however it's framed, it's hard to see how they're going to apply it. Someone did point out to me that apparently the private citizen who is suing is actually suing the person who helps the woman to get the abortion.
Right.
And that maybe somehow that person is supposed to pay the money. It's just, it's all insane.
Speaking of Brexit dipshits, this morning, Piers Morgan announced he's returning to Fox News,
right,
which he's very happy about. So the spread of further misinformation will find its echo chamber. And what you were saying, Matthew, this week I had to renew my healthcare benefits here for my wife and I through my employer. And it costs me roughly $10,000 a year, and we use it sparingly. But of course, for emergency reasons, we need it. So you pay it. And as I was going through the 5 different options that I had, just seeing the amount of money that I still have to pay on top of all of these services, and what $10,000 a year, what kind of discounts on the services, not coverage, discounts on most services it gives me is appalling. And so when I hear stories like what Julian expressed, and just the big picture view of everything happening around vaccinations, if Americans were really aiming at the enemy, we would be talking about the horrible, horrible healthcare system that we have in this country.
And I think I've said this before, but I just want to, if there are American listeners who need validation that it is that you are in fact living in a predatory and low-level traumatizing context with regard to the economics of healthcare, I would just like to affirm that, because every single experience that I've had with healthcare in a universal healthcare country has been one of extraordinary grace and gratitude.
Me too.
It's like I developed a very dangerous blood clot. And as I was in the emergency triage, there was a man next to me who was clearly experiencing homelessness and drug addiction, and he was having trouble not soiling the bed, and the nurses were taking care of him. And he was right beside me, and the doctor spent as much time with him as he did with me, and neither of us got a bill. Like, there was something about that just sort of basic level of social contract expression that is playing out day in and day out, that everybody walks through the hospital doors and they know they are not going to walk out bankrupt. And they know that through no fault of their own, if, they are 42 weeks pregnant and the baby looks like they're going to be 10 pounds and things are not progressing the way they should, and you wind up with an emergency C-section, that you're not going to be handed a $60,000 bill. Like, I can't express how much worse my life would be if I had to, tolerate the stress of that. So anyway, I don't know how you all do it, and I'm really sorry you have to. And I love you all.
Phil Gaiman is an ex-professional cyclist, and he's wonderful on social media about cycling. He was in an accident, I guess maybe about 2 years ago now, and because you're talking about like nationalized universal healthcare, Matthew, because he was in a different state than California, where he lives here in Los Angeles County, he's stuck with $150,000 in bills right now, even though he was fully insured. But because of the ambulance he used, which wasn't covered in his out of network, and because of the hospital he went to, he now is stuck with that bill in the country that he's already paying for healthcare in.
Yeah. So talk about bureaucratic, red tape and just getting completely screwed over. It's not like we do actually have some sort of straight shot, uncomplicated situation. And the thing is, you'll never hear a poor person in America complain about, well, gee, if I lived in some country that has socialized medicine, I'd have to wait a few weeks for this procedure that otherwise, will bankrupt me and my future generation.
To me, I'll say this again. I'm sure I've said this on the podcast a couple of times, but like, it makes absolute sense that QAnon is born in America. Like, because what could be more, what could be more sort of networked and opaque and life controlling and nefarious than such an incredibly chaotic system in which your vulnerabilities are always just ready to be pierced. Like, it's just, why wouldn't you be paranoid? And
yet the politicians who pander to them somehow persuade them to vote against their own best interests. And they use the exact grift that JP Sears is using. They link the concept, some abstract and low nutritional value concept of freedom, to voting against your own better interest, because, we'd live under communism if you were actually taken care of by your government.
It's really a feat of imagination, because you have to put whatever the moral panic is, you have to craft it in such an incredibly creative and persuasive way that it overrides what's actually happening to your life on a day-by-day basis. It has to completely make you forget that you actually are being oppressed by a cabal of, of negative